The insight into ill treatment research includes 2 large representative surveys and in-company case studies. In the Fair Treatment at Work survey, 8% of the workforce have been humiliated or ridiculed in connection with their work in the previous 2 years. 40% of these employees experienced moderate or severe effects on their physical health. 46% experienced moderate or severe effects on their psychological health. And 30% moderate or severe effects on their relationships. 18% of the workforce had been insulted at work or had offensive remarks made about them, and the proportions reporting effects on physical and mental health and on their relationships were almost as large. It's worth noting that the size of the effects on health and well-being was greater than the effects of actual physical violence in the workplace. This is not the only surprising finding in our work. For example, in the British Workplace Behaviour Survey, half of the British workforce experienced unreasonable treatment in the last 2 years. Of the 6 types of ill treatment they said had the most impact, 4 were types of unreasonable treatment. For example, having an unmanageable workload was said to have the most effect by more than 1 in 5 of those experiencing ill treatment, and having their views ignored was mentioned by 1 in 10. We're only beginning to get to grips with what is really going on here. The bullying literature established the negative effects of some work experiences on health and well-being, but our research is revealing a more complicated picture. For example, prior to our research, there were a handful of smaller UK studies of the aggressive management of long-term sickness absence and tough employer responses when employees might have been protected by anti-discrimination laws. Our research has confirmed that some organisations are doing their best to push employees out of the workplace when they have disabilities or long-term health problems. The consequence of this is that the negative effects of work on health and well-being are exacerbated.